I'm going to listen to your lungs, Mr. McGee.
To maintain an airway, first perform a respiratory assessment and ask the patient if he is experiencing shortness of breath or difficulty swallowing. Observe him for any symptoms of hypoxia or dyspnea. Based on his needs, use non-invasive interventions to help maintain his airway as appropriate.
Mr. McGee, let's try sitting you up on the side of the bed and see if that helps to ease your breathing, okay?
First, try positioning. To promote optimum lung expansion, help the patient sit in a semi-Fowler's or high Fowler's position, or on the side of the bed or in a chair, with his elbows resting on his knees. If he has COPD, suggest that he lean over a table with his arms propped up.
Let's try something different to relieve your shortness of breath. I want you to lean over the chair, and I want you
to expand the lungs with less transdiaphragmatic pressure, have the patient lean forward over the back of a chair or against the wall.
Breathe in and out. Let's give you another pillow.
To decrease orthopnea, support the patient's head on 2 pillows when he's supine, or raise the head of the bed to at least 30 degrees. To promote lung expansion and drainage on the affected side, turn the patient at least every 2 hours. If tolerated, position her to allow for gravity drainage. If she needs unilateral re-expansion, have her lie with the unaffected side down and the affected lung up.
How's that? I want you to put this pillow on
Next,
your abdomen.
try controlled coughing.
I want you to take 2 slow, deep
With the
breaths.
patient in an upright
Inhaling through
position,
your nose,
have him
exhaling
lean
through your
forward and place a small pillow or his hand on his abdomen to increase the expiratory pressure. Then instruct the patient to take 2 slow, deep breaths, inhaling through his nose and exhaling through his mouth. Now tell him to inhale deeply a 3rd
Next one, I
time,
want you to take a
hold
deep
his
breath
breath
in.
and count to 3.
Hold it.
Then have
for
him
a count
cough
of 3.
deeply 2 or 3 times while pushing air forcefully
And
from
try
his
to cough.
lungs and without inhaling between coughs. Remember to provide tissue for the patient after successful productive coughing, followed by appropriate hand hygiene. For a patient who has difficulty coughing,
I want you to
teach
take
her to huff
one
cough.
breath and then 3 times, and then give me a big cough.
Have her take a medium breath and then make a ha sound while quickly pushing the air out through her open mouth. And then instruct her to cough.
Mr. Schroff, I want to measure you for your CPAP.
If ordered by the
Can you take your
physician,
glasses
administer
off for me?
continuous positive airway pressure, or CPAP, or bilevel positive airway pressure, or BiPAP. To do this, first determine the correct size mask using a masking chart.
How's that?
That's better.
Good.
Next, position the patient comfortably with his head elevated and apply gloves. Then place the mask over the patient's nose or face and adjust the head strap until the seal is as tight as he can tolerate. If needed, obtain a different type of mask so that it fits comfortably. Connect the CPAP or BiPAP tubing to the pressure generator. After instructing the patient to breathe normally, set the mask pressure as prescribed.
Breathe normal, in and out through your nose.
For CPAP, the initial settings usually are 4 to 8 centimeters of water. For BiPAP, they usually are 8 centimeters of water for inspiratory pressure and 4 centimeters of water for expiratory pressure. If the patient is not already on pulse oximetry, connect him to it.
We're going to check your peak flow with the peak flow meter.
Okay.
Let me check your arm band.
To assess the effectiveness
I'm gonna
of
sit you
any
up
airway
all the way up
management
and then
technique,
crack the bed
measure the patient's peak
sitting
expiratory
straight
flow
up.
rate, or PEFR. Once you've explained the purpose of the measurements, help the patient into a high Fowler's
How's that?
position.
That's good.
Good? Okay. This is a peak flow meter. We're going to check to see how your lungs are doing.
Okay.
Then slide the mouthpiece into the base of the numbered scale.
I'm going to stick it on here for you. What we're going to do is try to shoot for the top. I want you to blow as
Instruct
hard
the
and as
patient
fast
to
as you
take a
can.
deep breath,
Okay? One time.
put the mouthpiece in her mouth,
Okay.
and close her
Don't
lips,
put your hands
making
on
a
the back
firm
of it.
seal.
Just hold it here. Don't put it on the
Now
back.
have her blow out as
Deep breath
hard
and
and
blow
fast
really
as
hard.
possible through her mouth.
Good.
Check
Let
the
me see what we got.
PEFR measurement and
We're gonna
repeat the
do it
process
again.
2 more
Try to get the
times,
best one out of
recording
3.
only the highest number on the patient's chart.
Here's the
As
book.
part of your follow-up care, observe the patient's return demonstration of PEFR measurements and assess her ability to record the measurements accurately, according to the evaluation tool used by your facility. One tool is the traffic light pattern, where a measurement in the green zone is 80 to 100% of the patient's personal best. This means no asthma symptoms are present. A measurement in the yellow zone is 50 to 80% of her personal best, which means caution. The patient may be having an attack and need treatment. A measurement in the red zone is less than 50% of her personal best, which signals a medical alert. She should take medication and call the physician immediately.